Well, I'm delighted now to be joined by Dr. Mirta Roses, who, as you know, is one of the co-chairs of this year's conference and also heads up the Pan-American Health Organization. Dr. Roses, thank you very much indeed for joining us today on Global Health TV. Now, in your presentation this morning, you talked about a couple of things, but you talked about obesity, and obesity being an issue for the developing world as much as the developed world.
Yes, I think that the key issue that we have been able to identify really is that this is about poor people. It is very much linked to poverty, and to, the rich people have more opportunities to capture information very quickly, and also they have many resources to change their behaviors and make their choices accessible also. But the poor people, they have a lot of disadvantages. First of all, they cannot handle information in the same way. They have not the same channels for information and access to information and connectivity. Their peers have the same conditions as they do, and not many of them are helpful, in overcoming as counselors. But also, even when they understand, are the measures that we are recommending accessible, affordable for them to make those choices? So really it's about poor people wherever they are.
One of the things you talked about this morning that really struck a chord with me was the link between malnutrition and obesity. Now, to a lot of people that just wouldn't make sense.
Well, and it relates also to what we were talking about poverty, because in the evolution of humankind, we have gone far, but still we have in our genes some mechanisms for the survival. And we have a kind of historical memory of starvation periods. So if that is triggered, and it happens also to people who go on extreme diets, and then they stop and they balloon when they start eating again. And that's because we have kind of chemical and physiological pathways that have been developed for survival. That is the same thing that is happening with children, even earlier than children, during pregnancy. There's a lot of this mechanism to protect the fetus. And if the mother is undernourished and also is not properly fed during the pregnancy, then there are lots of mechanisms to protect the life of the fetus. It's not that the fetus is going to come in the best possible way. It will have low birth weight, or it will have impact on the intellectual development and so on. But it will also come with some mechanisms in the metabolism that will protect him or her for starvation. When this baby is provided with the wrong food, highly processed, high in sugar, high in calories, and not nutritious, what is going to happen is that it will accumulate fat as a protective mechanism and will become obese. So we now see a continuum between undernutrition and hunger and vulnerability to obesity in early ages.
Now, the other main point you made this morning is that we need a new approach to combating obesity.
I think that we have been concentrating from the health sector mostly in what we call secondary and tertiary prevention, which means that we try to get either early in the disease, and if we get late in the disease, of course we have treatment and care and other measures. That is not enough. And what we have been seeing in the last 2 to 3 decades, even with countries, developed countries that started seeing this phenomenon earlier, that many of the measures taken from the health sector have not been productive in terms of curbing this epidemic. So we are moving upstream. Of course, first with primary prevention, which is on an individual basis, but also on a population at risk to try to reduce the risk factors. And now we are moving even ahead in looking at all other sectors, the whole of society. What are the environmental, what are the incentives, what are the social and economic definitions and environments that we have created, from urban planning to agricultural policies to education to reduction of physical activity because of transportation and so on, to what we call primordial prevention, which is trying to avoid that these risks enter in the population, and particularly in the most vulnerable population.
Sounds to me that's a big job.
It's tremendous, and it involves really a lot of partners stakeholders, in other sectors. So we have to put what is there for them to gain. I mean, we have to speak to the economic sector saying, if you do the wrong cuts in spending, you may be creating a tremendous loss in the near future, not in the long future, in the near future. Your economy is not going to grow because everything that you're going to gain from, for instance, reduced infant mortality and so on, and maternal mortality, you are going to lose immediately in the next decade because of this heavy burden of chronic diseases and obesity, lost productivity, burden for the families and the communities. Even, the designers are concerned. And we talk to the designers. All the furniture, the seats, the equipment, the airplanes, everything is designed on a standard body mass, which is not going to be the standard body mass. You know how much this is going to cost to the whole society to change those standards. So I think that we have to put the message in terms that the other people, the other sectors, the other stakeholders understand what's there for them to gain and why they have to change their policies. Some people say that technology has created a flat world, but we don't want humans to become balls rolling on that flat world, do we?
Well, Dr. Roses, thank you very much indeed for joining us today on Global Health TV. We could talk about this all day, but I'm afraid we haven't time. Thank you.